Hello YouTube, I'm Dr. Fox. Today, I'm gonna talk about fertility medications. So fertility drugs are taken by women who are unable to get pregnant naturally or their partners. The most common ones are clomiphene, citrate or clomid, metformin, gonadotropins, bromocriptins, and cabergoline, all of which have to be prescribed by a doctor. Some people take over-the-counter antioxidants and vitamin supplements to boost their fertility, but there is not much evidence to suggest they are effective. Okay, question. What conditions can fertility drugs be used for? Fertility drugs may be prescribed for women who cannot predict when they are going to ovulate, which in 80% of cases is due to polycystic ovary syndrome or PCOS. They are also sometimes prescribed for men who produce very small numbers of sperm or sperm with low motility, meaning the sperm do not move much, or who have had certain types of infection or inflammation. These drugs are also a treatment option for both men and women with certain types of hormonal-related fertility problem. Okay then, what can you expect if you have been diagnosed with a fertility problem? Your doctor will talk to you about all the options and the possible outcomes, which depend on what condition you have been diagnosed with. Some women or their partners just take fertility drugs, and others take fertility drugs and also have a treatment like intrauterine insemination or IUI or in vitro fertilization or IVF. The first fertility drug usually prescribed for women with PCOS who have irregular menstrual cycles is clomid, which stimulates your ovaries so they produce more eggs. Clomid is an effective drug, but if you are taking it, you have a higher chance of having a multiple birth, which can pose risks to both you and the babies. You may also be prescribed metformin. This was actually created to treat diabetes, but it can help women who do not ovulate properly because they have very high levels of insulin in their bodies due to their PCOS. A third possibility is gonadotropins, which are hormonal injections to stimulate egg production and are often prescribed for women who have tried clomid but still not got pregnant. If your fertility is low because you have hyperprolactinemia, you may be prescribed bromocriptine or cabergoline. Hyperprolactinemia means you produce too much of the prolactin hormone, which can reduce estrogen levels and prevent ovulation. Then, what if your partner has the fertility problems? Gonadotropins can be injected into men who have a low sperm count. The injections will stimulate the release of testosterone, which in turn stimulates the production of sperm. Some men take zinc, selenium, vitamin C, and vitamin E supplements to improve their sperm count or motility, but there is no real evidence to show that these are effective. Okay then, you may wonder if fertility drugs have any side effects. In some cases, yes, although a lot of people don't experience any side effects. Things to watch out for are stomach or headaches, bloating, hot flushes, breathing difficulties, mood swings, heavy periods, tender breasts, sleeping badly, weighing more than usual, getting spots, putting on weight, feeling dizzy, and vaginal dryness. If you are affected by any of these, tell your doctor. If you are using gonadotropins, you have to be particularly careful as there is a small risk that you have developed ovarian hyperstimulation syndrome or OHSS, which can, although only very rarely, be fatal. Your doctor will make sure you are aware of the symptoms to watch for before you start the treatment. Then, where can you get fertility drugs? It's very important that you only get your fertility drugs at a clinic after consultation with a doctor and under proper medical supervision. If you try to get them elsewhere, for example on the internet, you may not only buy the wrong ones for your condition, but you run the risk of serious side effects. Okay, lastly, what if fertility drugs don't work? Your doctor will talk to you through any other options you can take. First, they will try and find out why the drugs weren't successful, although sometimes it is not possible to know. Then, they might recommend you to take a different route to pregnancy, for example, IVF, IUS, or intracytoplasmic sperm injection or ICSI, surrogacy, or using donated eggs, sperm, or embryos. Okay, thank you for watching. See you soon.